this particular Babesia, it is what considered to be one of the emerging diseases. Like the first case, it was observed in the humans, in splenectomized humans, that is immunocompromised patients, in the year 1957. And later in the year 1969, this case of babesiosis was observed in the immunocompetent patient. That means whose immune system is fine, but still this particular disease was observed. And initially it was seen in few people, like here and there sporadic cases were seen. And now the things has become like there were many areas, especially in the United States, which were declared as an endemic for this babesiosis. And now what is this babesiosis? It is a protozoal infectious disease which is caused by an protozoal parasite which resides in the RBCs, or which infects the RBCs of the humans and also the cattle. So the first, this particular parasite was observed by Victor Babes. So he was the first person who has observed this unicellular protozoal parasite in the year 1888 in the RBCs of the cattle, especially in the areas of the Texas. So the cattle which were affected, especially the sheep, goat, or the cow, so these were affected with the high grade fever, and they were found to be like anemic, and they were also suffered with the yellowish dyspigmentation or discoloration of the skin. So which we generally call it as what? Jaundice. So therefore, in the name of this person babies, so this particular parasite has been coined, or the taxonomy was given as Babesia. And the disease that is caused by this Babesian parasite is called as what? Babesiosis. And since it has been first observed in the Texas, it is also called as Texas fever, or also called as Texas cattle fever, if at all, if it happens in the cattle, that is non-humans. And later, a special thing, it has been observed that Theobald Smith, so he was the first person in 1893. He said that there is a particular vector that is responsible for the transmission of this babesiosis. So what is that vector? So that vector is nothing but an arthropod, that is a tick. So in the tick, again, we have got how many types of tick, students? One is soft tick, another is hard tick. So hard tick, this particular hard tick, and especially the hard tick, what is a hard tick? The one which resides on the deer. So the tick which resides on the deer, so that particular tick we call it as what? Deer tick. And this particular tick is responsible for the causation of what? That particular tick is responsible for the causation of the spread of babesiosis. And the sexual cycle of the, because this particular organism Babesia parasite, its life cycle has got both forms. That is, one is sexual form of life cycle, another is asexual form. So the sexual form of the life cycle, it completes in the what? The tick. This point is very important. And the asexual form of the life cycle, it happens in the cattle mostly, and also in the humans or the man. So this point you have to remember from the community medicine point. Why it is important to us? Because now it is considered to be one of the emerging categories of the diseases. So initially one or few cases, and later what happened, there were many cases that has been observed. So this babesiosis is caused by the parasite, that is Babesia, and it is a sporozoan. What is a sporozoan? These are the unicellular parasites which has got a unique property of penetrating the host cells. So for example, if this is an RBC, so this is a parasite, it enters the host by penetrating them, by piercing the host cell membrane. Whereas if you see the amoeba and all, they have got one particular type of organ of locomotion, maybe pseudopodia, some others they have got the cilia, some has got flagella and all. But this particular sporozoans, they have got one sharper end. Because of their sharper end, they pierce and then they enter the cells, and they are intracellular, that is, they are present within the cells. And which cells they affect? The RBCs, that is red blood cells. And there are many types of the babesia. So like there are two types of babesia based on the size. One is micro, another is macro. So that means what? Based on the diameter, how big they appear. So if they are very smaller in size, we call it as micro babesia. If they are bigger in size, they are called as macro babesia. And for us, very important from the human point of view is babesiosis microshi. That is, it is the one which causes a human infection. Whereas other types of babesia are there which causes infection, especially in the cattle. What type of cattle? That is a sheep, goat, and many more other cattle. and it causes a hemolytic disease. What do you mean by hemolytic disease? It causes the lysis or the breakdown of the RBCs. And what is the case fatality rate? So case fatality rate means what? Because of this babesia, so how many people are getting killed? So that is a case fatality rate. So the case fatality rate is how much? 20%. So the general points about this babesiosis: what is the vector or the organism that carries this particular pathogen? That is the heart tick. So what is the scientific name of this heart tick, students? It is the Ixodes scapularis. So this is a scientific name. So this name you need to remember. It is also called as deer tick because it resides on the deer, because deer acts as a primary host for this particular tick. And this tick is also called as black leg tick. Why it is called as black leg tick? If you look at into this legs of this particular tick, the leg appears blackish in color. That's why it is called as what? Black leg tick. And this heart tick, it acts as a definite host. That means here the sexual form of the life cycle it happens. And what is the intermediate host? Intermediate host is a man and other animals. And we can also say that there is a reservoir for this babesia, that is where this particular babesia organism resides in it, but that organism doesn't catch up any symptoms of this babesiosis. So that reservoir is what? Rodent. So rodents are the reservoirs, intermediate host is man and other mammals, and the vector is Ixodes scapularis or the heart tick or deer tick. And this very important point is that the tick which transmits this babesiosis, it is also the same tick that transmits the Lyme's disease. So how do you differentiate between Lyme disease and the babesiosis? Is like the point where the tick bites. If at all there is a Lyme's disease, then there will be what? Erythema migrans. That is reddish color that happens, but it will be like expanding. So like it keeps migrating from one area of the skin to the other area. So that we call it as what? Erythema migrans. And whereas we don't see such type of erythema migrans in case of what? In case of which one, students? In case of babesiosis. So there are no skin lesions that are seen in babesiosis, whereas skin lesions are seen exclusively in the Lyme disease. And very important point is the same deer tick, it transmits what? Babesiosis and Lyme disease and other viral diseases and bacterial diseases also, like anaplasmosis or encephalitis. Now let us see one of the MCQ question. The disease which co-occurs with the babesia. So what is that disease, students? The disease which co-occurs with the babesia.
Lyme.
Students, yeah, just a second. Very good, Smriti. It is a Lyme's disease. So what is this Lyme disease? It is a bacterial disease. It is a bacterial
Bacterial disease.
disease. Next. Definitive host for Babesia. What is a definitive host? What is the meaning of definitive host? It is a host in which the sexual life cycle happens. That is, male and female gametes, they fuse, and then what happens? A new form will be formed, and that form will lead to the zygote will form, and that zygote will convert into furthermore different differentiation will happen, and it will form vermicules, and this vermicules later will convert into sporozoites, and these sporozoites are infective to the humans. So what is the definitive host for Babesia, students? Is it Ixodes,
Ixodes.
mite? Yeah, which one's Smriti? What is the
Ixodes. One.
excellent answer? So it is a Ixodes. It is a heart tick. It is also called as what? Deer tick, because there are so many ticks with the different names. One is dog tick is there, deer tick is there. So different varieties of ticks are there. So for us, the deer tick is very important. Next, true about Babesia. It is seen in the RBCs. It is common in the month of May, and it is spread by the tick bite, or all of the above. What is the answer, students?
All of the above.
Wonderful answer, Smriti. So the answer is all of the above, because this Babesia affects the RBCs, and this disease seen where like peak of this disease season is in the May month. Why? Because it is a month where this particular heart tick, that population will be more, so they'll produce the eggs and they will come out and they will infect the man in the month of May, and they're spread by the tick bite. So all of the above is the answer. And what is the case fatality rate of Babesia? What is the case fatality? 20%, 40%, 50 or 65?
40%.
No, it is 20%. So these are some of the numerical facts. So we can't say anything. It is 50, why it is 50 and all. So it is like 20%. This number you have to remember. So Babesia, if you remember alphabets A, B, so B is the second alphabet. So Babesia is B and it is second number. So 20%.
Hmm.
Now let us say a little bit about this Ixodes scapularis. So this Ixodes scapularis is nothing but what? It is the heart tick. So this particular heart tick, it has got different things. It is like first the egg will be there, and from the egg the larvae will come out. So this is a first stage, and then this larvae, what will happen? It will come out, and then it will feed on the mice or the rodent. That is a white-legged rat. So can you see here white-footed rat? This particular rat, it is found in the forest and especially its foot is white in color. So whenever such white-footed mammalian like rat, it is there, then this larvae, it will go and it will occupy its body and it will start sucking the blood. Once it starts sucking the blood for 3 to 4 days, then what will happen? This larvae will become engorged. That is, they will become swollen up. Now look at the color. So inside its body, full blood is present and they are swollen. They are called as engorged larvae. And then after a few days, what happened? After 2 to 3 days, this larvae will get converted into next stage that is called as nymph stage. Now this is very important. This nymph, what will happen? In this nymph, this Babesia parasite will be present. So from where it has got this Babesia? From the mice. So from this infected mice, the Babesia or the Lyme disease causing organisms, they will be entering into this particular nymph. So now this nymph, it will come and it will enter the, it will get converted into what? Adult form. And in case if this nymph comes and bites the humans, if it bites the humans, then what will happen? We will get this particular babesiosis disease. So which is responsible for the causation of the disease, students? It is a nymph form of this particular tick. And once this nymph is there, it will get converted into adult form another 2 to 3 days. And this adult form, it will go and habitat over the deer. So this is a white-tailed deer. So white-legged mice and white-tailed deer, these are the two important hosts for this tick. Next, what is the mode of transmission of Babesia? So the first thing is that because of the tick bite. Second thing is because of a whole blood transfusion. That is, all blood components will be there. So whole blood transfusion. Next is packed RBC transfusion. So these are the three main sources of transmission of babesiosis. Next, Babesia and Lyme disease, they occur together. And very important is that babesiosis is an opportunistic infection. This point you have to remember. So who are immunocompromised like HIV affected people or pregnant ladies or even infants or the small children or whose spleen is not absent or splenectomized patient. So in all these immunocompromised cases or even in the older age patients, that is geriatric. So these are categories for this babesiosis. And what is the incubation period? So this is very important. So what do you mean by incubation period? It is a time from when the parasite enters the host and from when the since the time the parasite enters and the time when the disease manifestations are seen. So that is incubation period. So it is 1 to 6 weeks. So maximum we can say 1.5 months. That is the incubation period. And what is the infective form? It is the sporozoites, which are transmitted from the ticks. They are the infected to man. And in severe babesiosis, see babesiosis, the clinical feature, it can be mild babesiosis or it can be severe babesiosis. So severe form of babesiosis means what? There will be 4% parasitemia. Emia means what? This particular parasites, they are seen in the blood, at least their count should be 4%. If the parasite count is 4% or more than that, then the clinical presentations will be very severe. So if it is less than 4%, there will be mild clinical manifestation. And very important thing we need to know is that endemic areas for this babesiosis. So if you see this map of the United States of America, so this is very much endemic to the American areas, and nowadays some of the Asian and also European areas also we can see this babesiosis, but not a quite very good number of cases. So we can straightforwardly say that it is endemic to north eastern US regions. northeastern. So this is the north and eastern. This is the eastern section of USA. So this is the area of the map of United States where this babesiosis is endemic. All the time this particular disease is present in this area. So what are those particular places? One is Nantucket, Connecticut, Eastern Seaboard. So you need to remember this, because if you are giving any entrance exams like other USML also, they may ask this particular question giving these geographic areas. So now why it is important, because these are the areas where this particular tick population is very high. Next, what are the clinical symptoms of this babesiosis? So usually most of the infected people, they are asymptomatic, or if it is mild cases, they may present with malaise, that is body aches. Then there will be chills and fever, headache, and myalgia, arthralgia, and the patient may also have anemia, because all the red blood cells, they are ruptured and they are destroyed. So the patient, what happens, since the RBCs are affected, the oxygen carrying molecules are also destroyed. So what will happen, the patient will feel fatigue and the associated symptoms. Now how to confirm the diagnosis based on the clinical history, students? So you need to ask the patient the history of travel, which is very very important. So ask the patient, did you travel to any of the endemic areas, Nanchiki or like Connecticut, or what seaboard, so eastern seaboard. So all this northeastern part of the US, they are the endemic areas. So please ask the patient, did you travel to these particular areas? And also ask the history for tick bite. Did you get any insect bite, or especially the tick bite? So ask the people over there. And if it is not treated properly, then it may land up in the complications, that is renal failure, because of massive hemolysis. RBCs are getting lysed, disseminated intravascular coagulation, and also congestive heart failure. So these are the most common what complications associated with the babesiosis. And what how do we diagnose this babesiosis? So one thing is blood smear. So make a thin blood smear and examine that blood smear slide under the microscope, and there you can see the babesia. Now under the microscope, how you differentiate, like how do you identify it? So within the RBC, can you see these students? So some pear shaped, so something like this they are present. Some four things are there. So these are nothing but called as Maltese cross in the RBCs. So what do you mean by Maltese cross? So within the RBC, the Babesia organism, it will be dividing by means of what? Budding. So this is a mode of division. So this trophozoite form of the Babesia, it will enter the RBC and it will start dividing. And this division is indicated, or they are arranged in this particular fashion, in this cross fashion. So this particular cross fashion is called as what? Maltese cross. So look at this particular symbol. So this is, we generally call it as what? Maltese cross. And this is a pathognomic of this babesiosis. And you can also go for complete blood count, that is CBC, where you can see hemolytic anemia, and there will be hematocrit value, it will be decreased, and there will be more amount of reticulocytes. What are these reticulocytes? Reticulocytes are nothing but the younger RBCs, because all the RBCs are getting destroyed, so our marrow will start producing more and more younger RBCs. And another test what we can do is urine test. Why urine test? Because lot of hemolysis, so that hemoglobin will be thrown in the urine in the form of what? Hemoglobinuria. So the urine will appear dark reddish in color. So it is basically nothing but the hemoglobinuria because of the lysis of the RBC. Now, what is the treatment of this babesiosis? So, what we can do is that atovaquinone 750 milligrams twice daily with azithromycin 500 milligrams per day for 7 to 10 days. So, this is very important drug combination, atovaquinone plus azithromycin. So this point you have to remember. Or you can go ahead with the clindamycin with quinine if it is a severe case of babesia. So you need to give them intravenously. So orally you can give atovaquinone or azithromycin. So let us see one of the MCQ related to this. One day, following a visit to woods along the eastern seaboard beach, a 50-year-old develops a fever, headache, chills, and fatigue. A blood smear demonstrates within a erythrocyte some parasite. Which of the following is the most likely pathogen? What is the answer, students? What might be the probable answer, Smriti? So what we have seen is that the patient has gone to the eastern seaboard. So it is one of the place in United States. So that place the patient has gone. So this is one history is positive. So because it is an area where this babesiosis is common and the patient is 50 years old, that is old age. So this is another point. And the clinical features, if you see, the patient is having fever, headache, chills, and fatigue. So these are all classic fevers are there, and we have done the like microscopic examination within the RBCs, we have seen a parasite. So then among all the given options, the answer that matches over here is Babesia microshi. Next, Maltese crosses in the RBC are seen in. It is seen in Plasmodium falciparum, Plasmodium malariae, or Babesia, or Entomobia. So what is the answer, students? So the answer is what? The answer is Babesia. So Maltese cross within the RBCs. So what are these Maltese cross? So the parasite that is arranged in this particular tetrad fashion. So that is Maltese cross arrangement, which is a characteristic feature of babesiosis. So the option is 3. Now coming to the next disease, that is toxoplasmosis. So toxoplasmosis is also a parasitic disease. It is caused by the unicellular protozoal parasite which belongs to epicomplexa. That means again they penetrate the host cell membrane, and it is caused by what? Toxoplasma gondii. So this point you have to remember. So gondii means what? It is a rat, because this particular toxoplasma was first observed in the gondii. So therefore it is called as Toxoplasma gondii. Then why it is called as toxoplasma? Toxo means what? It is an arc shaped. So if you look at the structure of this particular organism or the parasite, it appears in the form of an arc shape. So that's why it is called as what? Toxoplasma gondii. Next, it penetrates where students, especially in the macrophages, that is reticuloendothelial cells. Whereas if we have seen malaria causing organisms, that is Plasmodium, Babesia, all this they affect what? RBC. Whereas Toxoplasma, it will penetrate the macrophages. And what is very important, what is the definitive host? That is a cat. So be careful with the cat. And intermediate host is a mice, rat. So Tom and Jerry. And who is the accidental host? That is a man. So we are the one who are accidentally affected by this or infected by this Toxoplasma gondii. Now the life cycle that of the Toxoplasma that happens in the cat, it is called as what? Enteric cycle. And the life cycle that happens in the man, that we call it as what? Exoenteric cycle. Yes, students, are you all clear? Smriti, next. Am I audible, Pulikesh? Okay, now let us see what are the
Yes, madam,
sources of
audible,
this.
madam.
Yeah, what are the sources of this human toxoplasmosis? So now I have told you that the cat also will get affected, and even rat, and even sheep, goat. So there are many animals that are getting affected, but humans, we get accidentally affected. How? So it is like when the cat it defecates. So through the cat fecal matter. So when the cat defecates, what happens? Its fecal matter contains oocyst. So when we try to play with the cat, so this oocyst it will enter into our what? It will enter into our fingers, and we accidentally consume this oocyst, and then we get infected. Or the infection may also happen because of the undercooked meat. So if you see the thing over here, from the cat it will come, and then this oocyst it will infect the rat, and then what happens? It will spread to other animals or the mammals, or the cat fecal matter may also be contaminated to the pig, sheep. And then what will happen if the human eat this infected sheep or pig, and if its meat is not properly cooked, then definitely we also get contaminated or infected. And another mode of transmission is through organ transplantation, that is persons who is already infected, and if his organs are taken, then the thing may get transmitted, or through blood transfusion of an infected person, or it can happen because of the vertical transmission that we call it as congenital toxoplasmosis. So the first three, they are what? Acquired toxoplasmosis. This one is congenital toxoplasmosis. Now this Toxoplasma gondii, it has got the three morphological forms. So it appears in the three different forms. So one is the trophozoite, another is tissue cyst, another is oocyst. Trophozoite means what? They are eating fellows. They do eat, and they are the feeding forms. And there are like trophozoites. Like there are two types of trophozoites. One is tachy, another is brady. So tachy means what? These are the trophozoites which keep on dividing fast. So they are the fast dividing. So since they divide very quickly, so they are like tiny. So they are smaller in size. So tachy T and tachy is tiny. They are smaller in size. Now what is the shape of these tachyzoids? They are crescent shaped. So look at this. How they are looking? They are looking crescent shaped. That is half moon shaped. Then they are basically the asexual forms, and they are commonly seen in the acute infection. So this point is very important, and they are the ones which causes the which are responsible for the vertical transmission. So from the mother to baby or the fetus, if it is affected by Toxoplasma gondii, means what? It is basically the tachyzoids that are affecting there. Now what happens if the same tachyzoids, if they go into some deeper organs like brain, or if they enter the eye, liver, spleen, what happens there in those organs? They go and they sleep, and then they slowly multiply. So they are like, because of the slow division, they assume a rounder shape, and surrounding them a nice cyst wall is formed, thicker wall is formed, and they remain dormant, and they are commonly seen in the chronic stages, and they are called as what? Bradyzoids, and they live for many years. So these are bradyzoids. Now another thing is that in the cat, now what happens in the cat, another thing is seen, a special form, that is a oocyst. So these are the sexual forms. So these oocysts are nothing but male and female gametes, they fuse, and they result in the formation of oocyst. Now the cat fecal matter, it defecates this oocyst, and then when this oocyst falls on the soil and under favorable conditions, under proper humidity and temperature, this oocyst will undergo sporulation. And now within the oocyst, what happens? There will be sporozoites. So like totally there will be 8 sporozoites within this oocyst. So this point you have to remember. So very important form thing about Toxoplasma is that all the three forms, that it's trophozoites, tissue cyst, and oocyst, they are all infective to the humans. Now let us see the one of the MCQ. Dead end host of Toxoplasmosis. Who is the dead end host? It is cat, rat, man, or sheep. The answer is man, because deadened means what? From him, after that, there is no further transmission. Because if the cat is infected, from the fecal matter of the cat, rat may get infected, or pig may get infected, or a sheep may get infected. Because cat will eat rat, or what happens? The pig may eat this thing, rat, or man may eat this one, sheep or pig, whatever it is, but nobody will usually eat the man. So like what happens, if the man is affected, the infection will remain in the man, so he cannot spread it to anybody else, that is to next human. So man is called as what? The deadened host. Next, which is responsible for the congenital toxoplasmosis? Is it bradyzoids, tissue cyst, tachyzoids, or oocyst? Which one is responsible, students? So it is the tachyzoids, that is the rapidly dividing forms. Next, what are the clinical features of the acquired toxoplasmosis? So basically, if the person is infected with Toxoplasma gondii, then what happens? Usually the person will be asymptomatic. But if the symptoms are seen, then what you can see cervical lymphadenopathy. That is, there will be swelling of the lymph nodes of the neck region. So that is cervical lymphadenopathy. Usually they are bilateral. That is, both the side lymph nodes are swollen, symmetrical, and they are non-tender. So bilateral, symmetrical, non-tender lymph node enlargement will be seen, and it is seen within weeks of the infection, within few weeks of the infection. And 20 to 30% of the patients, they will show generalized lymphadenopathy. So along with the cervical, and most common will be inguinal lymph nodes. They'll also be enlarged. Apart from that, the patient will be presenting with the fever, headache, myalgia for 2 to 3 days. And very important is that chorioretinitis, which we call it as what? Ocular toxoplasmosis. It is called as what? Ocular toxoplasmosis. Then apart from that, the patient also will be may manifest or show acute encephalopathy. So that means what? If the brain is infected, then patient will present with acute encephalopathy. Then along with that, patient may also show with hepatosplenomegaly. And usually this particular toxoplasmosis is acquired toxoplasmosis, self-limiting. So no need of any treatment, it will heal by its own. Whereas very important is with the HIV infected patient. So like if at all the patient is HIV infected and if he gets a primary infection of this toxoplasmosis, then usually it is a fatal condition. It is a fatal condition. Or if at all there is a reactivation in the HIV patient, still also it is dangerous to the patient. And very important thing is that in HIV infected patient, it affects the brain, that is cerebral infection or cerebral or toxoplasma encephalitis is a very important thing. Very important is that these patients will be presenting with seizures. And what part of the brain is affected? Brainstem, basal ganglia, and corticomedullary junction. So these are the areas of the brain which are most commonly affected with the toxoplasma gondii, if at all it is seen in the HIV affected patients. And in rare cases, what will happen is the patient may present with pneumonitis or myocarditis, that is, muscles of the heart is inflamed, or pericarditis, so surrounding layer of the heart is infected, or polymyositis, hepatitis, or encephalitis. So these are in rare cases, these manifestations can be seen. Now coming to the congenital toxoplasmosis, related to this, first trimester is very dangerous. Like if it happens, then maximum damage to the fetus can happen. And in the third trimester, there will be maximum transmission. Damage will be less, but lot of transmission may happen, nearly 65%. And most severe form of toxoplasmosis can be seen in neonates. So that is within 1 week of the birth, if it happens, it will be most severe form. And what are the classic trait of the congenital toxoplasmosis? There are three very important things. One is chorioretinitis, then cerebral calcifications, then hydrocephalus. So chorioretinitis, then cerebral calcification, then hydrocephalus. So these are the three classic triad of the congenital toxoplasmosis. Apart from that, the baby may present with the convulsions, microcephaly, hydrocephaly, and even mental retardations, like even the blindness, deafness, strabismus. So like it's like very dangerous it is. It doesn't leave anything, like everything is gone from the baby and its life will be like of no use. So that's why it is like very much important that we need to able to detect this, or mother should be treated well before she conceives, or proper care should be given, or if nothing is taken properly, like better to get it aborted, or else the nature only take care that the fetus may not survive. There may be stillbirth also. Now let us see one of the MCQ. Which of the following statement regarding the congenital toxoplasmosis are correct? Except most severe form of congenital infection occurs if it is acquired in the first trimester. It is correct. In first trimester, most severe form always occurs. Next, chorioretinitis and hydrocephalus are common manifestation in congenital infection. It is also correct. And presence of toxoplasma specific IgM antibodies in an infant are suggestive of the congenital infection. This is also correct. And the fourth option is most severe form of congenital toxoplasmosis occurs in the third trimester. No. Third trimester maximum transmission will happen, but the most severe form it will happen only in the first trimester. So what is the answer, students? What answer you need to give? So the answer is except means it is the fourth one. Next, intermediate host of the congenital toxoplasmosis. What is the intermediate host? So intermediate host is sheep, cattle, pig, and all of the above. So the answer is all the three. So the answer will be fourth one, all of the above. Now, how to diagnose this toxoplasmosis? First is microscopy. Look under the microscope. So, microscope, what you want to see? You want to see the tachyzoids, and you want to look for the tissue cyst. So, where do you for that? What samples need to be collected? Blood sample, sputum, CSF, that is cerebrospinal fluid, amniotic fluid, lymph node biopsy, bone marrow biopsy. So, you can take any of this and try to look for this tachyzoids and also even the tissue cyst. And oocysts are seen in the cat. Next, Another lab diagnosis is Sabin Feldman dye test. So once an MCQ question has been asked related to this, so it is very, very important. So what is a Sabin Feldman dye test? It is a serological test for Toxoplasma antibody. So we are trying to check for the antibody. So if the person is infected with the Toxoplasma, then what will happen? If our body has produced antibodies against this or not, we want to check it. So it is basically a complement mediated neutralization test. So what we take is that we take the infected patient serum and we take the serum of the healthy person, and then we incubate them for 1 hour at 37 degrees. Then after that what we do is that we add a dye and then we check it. So if there are antibodies, what will happen? These antibodies will destroy the tachyzoids, and so nearly 50% of the tachyzoids should be destroyed if there are antibodies produced in the host. So what will happen? Only 50% of the tachyzoids will take up the stain. And if the stain is taken by more than 50%, then what we have to assume that the antibodies are less produced. So that means what? The person is negative for this particular toxoplasmosis. So it is nothing but the highest dilution of the serum which inhibits the staining up to 50%. Next, other serodiagnosis test for this Toxoplasma gondii is antibody detection by means of ELISA, latex agglutination test, and antigen detection by means of recent, which indicates a recent transmission. And if you want to check for IgA antibody detection, especially in the newborns. And other molecular methods are like PCR. Then imaging, like you can go for CT scan, MRI of this CNS, or you can go ahead with the USG of the fetus. And other test is like skin test for pharyngeal. So it is basically delayed hypersensitivity test. So intradermally we inject this toxoplasma like antigen, we check for the reaction. So like within 42 or 48 hours, if we see some reaction, then it is a positive. But they are not like very much like a sensitive test for this particular toxoplasma. Now, what is the treatment for this toxoplasmosis? If it is congenital, then go ahead with the give oral pyrimethamine 1 milligram per kg daily, and also give sulfadiazine 100 milligram per kg with folinic acid for 1 year. If the patient is a HIV positive patient, then you have to give sulfamethoxal with trimethoprim, that is nothing but co-trimoxyl combination. So with this, I want to conclude with the today's class. So we have learnt with which one, students? So we have learnt with two things over here. So one is Babesia, another is Toxoplasmosis. And I'll continue with the other infectious disease in the next class. Thank you. So Pulikesh, the class is over. So shall we stop this? Are you there, Pulikesh? Smriti?
Yes, madam.